over to you. Thank you. Thank you, everyone. My name's Carolyn Fowler, and I'm just one of a lot of people that did this work. And I'm just the mad one with Jenny that's going to stand on the stage. So I'm Deputy Director of Nursing here, if I can find my... And this is our trust. And the reason we put this up is because, like most good pieces of work, it involves a lot of people. And one of our challenges is being over 4 sites, having satellite units, and ensuring that our patient experience and the quality is actually standardised and we're delivering the same standards. So we're going to talk about the access of information, how we developed information. We started really looking at a strategy for patient experience and slightly went off target for a while looking at information because that's what our patients were telling us about. They were saying they didn't understand what was on the wards. Was it for them? Was it for the staff? It was confusing, and we realised that we hadn't engaged with patients enough about what they wanted to know. So it was a very important piece of work, and we ran focus groups. And I think what we did probably, well, what the team did very well was they engaged with everyone, including, as Joe mentioned earlier, the public as well. We have a large group of members. We're not a foundation trust, but we have developed that, and that's had a strong input in how we see things. So we wanted to have something that was core and standard, but was different for every area. And that every area, every ward, every service area was empowered to use the standard but create their own information within it. So I've whizzed on now. I'm just going to go back a minute and just tell you a bit more about this. What's important was, and part of the hard work, was actually each piece of information that we developed had what was mentioned earlier, actually a story behind it, because each piece of information was developed through people's experiences. And as we go through the presentation, we're going to show you some of the information that we've developed, but I just want you to be mindful that behind each one, it's not just a piece of information, it's people, it's carers, patients that actually told us what mattered to them, and we took that and then put them in the information. I'm going to hand over to Jenny, who's going to run through a few slides for you.
Hello everyone, I'm Jenny Pennell, the Project Manager for Nursing and Patient Experience at East and North Herts Trust. So to start with the poster that or the information, move on. There we are. We wanted to look at how we encouraged patient feedback and to have a consistent style across the trust. So we developed our Tell Us What You Think About posters, and we have unique posters for each of our 4 hospital sites and also for our satellite units. So we look at the different ways that we encourage feedback. Primarily, we want to encourage feedback on the wards or in the departments. So if there are any issues or patients have got any concerns, we would like to raise them to be raised at the time. So we do encourage that. We also have all the usual surveys, friends and family test. We're particularly good in our trust, I think, at looking at comments from social media, NHS choices. And our communications team always respond very promptly to any concerns or positive feedback that comes through, and it's always shared with the teams. I would say sort of within hours. Our posters were developed to also include feedback about PALs and complaints, so patients are aware of how to contact those teams. We developed a comments, concerns and complaints leaflet, which replaced several individual leaflets that we had, just pulled all our feedback into one area. And we also developed an easy read version of that in conjunction with our health liaison team, so our learning disability specialist nurses. We've got copies of these on the stand that you're welcome to take away if you come and see us afterwards. So we have quite a wide variety of patient experience surveys, and we use an electronic patient experience system, Meridian, which means that all of the feedback is available real time to all of our staff. so they can go onto our intranet system and look at the comments that are being made about their wards or departments straight away. We work very closely with the Complaints and PALS team, and we produce a joint board report so that all patient experience is fed back to the board in one place. We're also particularly good, I think, at listening to patient stories. So we encourage staff, there's a short training programme that they come on, and then we encourage staff to go around different areas of the trust listening to patient stories. Our chairman, I would say, is particularly good at this. He's very keen to go around and listen to what patients have got to say. And we always start our trust board meeting with a patient story. So that may be a patient or a relative or a carer coming in person, or sometimes we have audio recordings, or we read out. If patients are perhaps not comfortable in coming to a group like that, we would share their feedback with the board. We wanted to share information about the Friends and Family Test with our patients and visitors and staff. So this poster was developed with patients, looking particularly at the wording for the Friends and Family Test question and trying to explain that in a plain and simple way for people. I think the scoring sometimes is difficult for patients to understand, but we felt that this put it over very clearly, explaining the percentage of patients that would or would not recommend a ward, and we tied this into the number of compliments and complaints that each ward or department receive each month. So these posters that are updated every month, we save these on a shared place on our trust intranet, so the ward sisters go on each month and update the information. The key information that we want to get from the feedback we get from patients is what we can do to make things better. So we have our Learning from Your Experience posters. So we ask all the wards and departments to update this information every month. And this is a fantastic way to get over just those small improvements that each ward is making every month. So they could be looking at their survey responses, or perhaps comments, PALS comments or complaints, or anything that's just been pointed out by a patient that needs improving. So we encourage any sort of feedback to be recorded on this information. And we look at this every month and we pull together a short summary which we share with our trust board. So this will be part of our regular board report, so the exec directors and non-execs get to see and share this information. And we also share it on our trust website. Thank you.
I'm just going to, because I know we haven't got very much time, just going to run through some of the posters that we have, and everyone's welcome to share them. I think what I'd just like to say is I know by speaking to a lot of you, you're already doing this sort of work and have got some really good ideas, and I've seen some good examples. So I think it's just about building on each other, what we've all done, and putting it together, and I'm sure we'll be looking around to see how we can improve further the work that we've done from some things other people have done. So this is one of them, Visitors Charter. We've actually got 11 posters that we have. A couple of them are outside of the wards. This one, patients said they wanted outside to be able to look at maybe when they're standing to waiting to come in. And the other one that we put outside is the meal times. And when I said about a story behind every poster, when we started this, we realised actually we still needed more work around protected meal times, because what we understood was every single ward was slightly different on their timings, and then the whole piece of work was done around how the trolleys arrive on the ward and getting them exactly the right place for protected meals, and ensuring that everyone was ready to put down their work, put on their aprons, and go and actually look after the patients and feed them. So it's not just a set of posters for us, it is a story. This one, I've spoken to lots of people, the constant, what do we do about uniforms? We thought we could probably have about 5 different posters, but I think we've got about 25, because every ward has slightly different needs, but they can pick and choose the uniforms that they want. This is an interesting one, really, because we wanted to tell patients some information, something we thought was important, but it wasn't what they wanted to hear. This is what they've actually chosen themselves. We were displaying our news scores, which we thought they might be interested in, but actually fundamentally they weren't interested in escalation and numbers. I guess that makes sense. So we really listened, but they were interested very much in infection and falls and things like that. And I think the important thing with this is it has to be a living piece of work, and we go back and re-ask, because there isn't always one answer forever. Once you've done a piece of work, it's about how you look after it and move on. Staffing, I bet a lot of you got staffing posters. Sorry. Okay, just to tell you, because I like this one. And so you've got to look at this one. And actually this one's gone back and forwards to get it right, because patients said, this is absolutely a patient public piece of work. And we are totally led by this. We did not influence it. They wanted the thermometer. They didn't like things, although we were quite firm about some things. They didn't want it, so it was for them, and we changed it several times. And this is the final one for the moment. Okay. There our proud ward manager showing the posters. Thank you very much.
Thank you. Thank you.